to recognize our dignitaries who are also more or less our guests of honor. They are here this afternoon. And to give them a feel of the experience, we're going to do a very quick exercise. Probably take us about 15 to 20 minutes to do, so that you can feel and experience what has been going on. So, ladies and gentlemen, in our midst, we have the UNFPA Deputy Country Representative, Mr. Daniel Alemo, who has made it here. With him also, we have the head of cooperation, the Embassy of Sweden, Mr. Adam Kasai. Yeah, perfect. And Mr. Adam didn't come alone. He came with Ms. Annalie Areska. And then also we have Commissioner Dr. Angela Nakafero from the Ministry of Gender, Labor and Social Development. So, ladies and gentlemen, these are our guests of honor today, and we honor them for being and making time to be part of this experience. So, we have had 10 exciting, innovative ideas presented here. And we have also with us 5 wonderful, experienced judges who have been part of this process and have been able to come up with the 3 companies, or 3 innovative ideas that are going to walk away with the money that will be able to help them implement these ideas, these novel ideas. So I just wanted to introduce the judges to you quickly, and I'll ask Mr. Sidney Hashi to put on his video so that when I read out his profile, you can be able to see him. So I'm going to read out their profiles quickly, and then we are going to do a quick raffle where we have listed all the 10 companies or organizations that have participated, but would like to randomly pick 2 that will just share their idea once again, so that you can see the process with which they've been able to go through. So, judge number 1, Mr. Sidney Hashi. Mr. Sidney Hashi is the Regional Innovation Specialist for UNFPA in the East and Southern Africa region, where he leads digitalization and innovation mainstreaming to accelerate program efficiency and impact acceleration. Before joining the UNFPA, he was the coordinator of the African Education Fund at the African Development Bank, a $300 million fund aimed at providing financing for education, science, technology, and innovation led by Africa for Africa. Sidney has spent 15 years of his life supporting community systems and empowering young people to achieve their best potential. He spent 7 years with the British Council developing social innovation ecosystems through empowering young people across Africa. Sidney has a passion for technology and ecosystem approach to innovation programming. Sidney holds a master's degree in international law from the University of Cambria, UK, and a bachelor's in economics from the Central University, Ghana. Ladies and gentlemen, Mr. Sidney Hashi. With us also on the judges panel is Ms. Lydia Wasula. Ms. Lydia Wasula is the Principal Probation and Social Welfare Officer at the Ministry of Gender Representative. Lydia heads the National Child Wellbeing Implementation Unit. She oversees the implementation of the National Strategy to End Child Marriage and Teenage Pregnancy. She coordinates the Interministerial Child Wellbeing Committee, among others. Ladies and gentlemen, Ms. Lydia Wasula. With us on the judges panel also is Mr. Solomon Kahuma. He is the co-founder of Drag Dash, a software developer with expertise in data visualization, and as a co-founder of Drag Dash and software developer with a keen interest in data visualization, Mr. Solomon Kahuma's technical acumen brings a unique perspective to the judging panel. His knack for crafting engaging visualizations and his innovative mindset position him to discern impactful and creative solutions presented in the HackLab. Ladies and gentlemen, Mr. Solomon Kahuma. Also with us is Miss Faith Myra. Faith Myra is the chairperson of the Yali Regional Leadership Center, East Africa, Uganda alumni. She is an independent consultant in gender, adolescent, and youth sexual reproductive health rights. For 6 years, Myra has worked in the public health sector, especially on the components gender transformative approach, human rights-based approach, and meaningful youth participation. She has led and provided strategic support in research, monitoring and evaluation, business development, and advisory services for civil society organizations. She has worked throughout East Africa and with partners in Ghana, Ethiopia, Malawi, Pakistan, and Indonesia. Ladies and gentlemen, Ms. Faith Myra. And our fifth judge on the panel is Mr. Moses Kidega. Mr. Moses Kidega is the Secretary of Labor of the National Youth Council of Uganda. He is a qualified software engineer and lawyer from Makerere University and is passionate about tech innovations. Mr. Kidega is the second runner-up of the Legal Hackathon 2019 and is the outgoing president of the College of Computing and Information Sciences, Makerere University, and brings on board vast tech experience. Ladies and gentlemen, Mr. Kidega Moses. So someone may wonder why we had to go to do this afresh, but this is to show that first of all, they have the competence and the credibility to be judging and judging impartially, okay? So, where's the, okay? So we're going to get a neutral person, of course not me, who would just randomly pick two pieces of paper, and on the pieces of paper are the names of the companies that are presented here, and then we'll have those two just share quickly their pitch, and then we will get into the rest of the program. So I want a neutral person, preferably I think from the team here. Okay. So Bulamu Bridge AI, just come and share quickly. I think run their presentation there so that they can do. And then the next one, as Bulamu does that, West Nile Community for Rural Development. Yeah? Yeah. Okay. So you can actually go up. Let me get you the clicker.
Hello, everyone. My name is Teddy Nalwanji, and I am the co-founder of Bulamu Bridge AI, a company solving the critical issue of unintended pregnancies among teenagers in Uganda. We were founded at the peak of the COVID-19 pandemic when the government of Uganda imposed travel restrictions on all persons. As volunteer doctors in rural Uganda, we witnessed teenagers as young as 14 years of age lose their lives due to complications related to pregnancy due to failure to seek appropriate care. That problem, however, hasn't been happening in rural areas only. In 2020, over 8,000 teenage pregnancies were reported in Kampala, Uganda alone. Teenagers in Kampala, Uganda have high rates of unintended pregnancy due to lack of practical guidance about SRHR and a stigma associated with seeking sexuality education. Our solution is the Bridge AI app, an interactive platform aimed at combating teenage pregnancies. The Bridge AI app incorporates a period tracker that provides teenagers with information about the menstruation cycle, fertility, and safe days, and therefore enables them to track their periods. It has a virtual consultation platform that allows teenagers to work with certified professionals who provide them districtly with information related to contraceptive use. It also has an online store where teenagers can districtly order for contraceptives without any judgment. This blend of convenience and privacy allows teenagers to take charge of their reproductive health. In a country where teenage pregnancies are a significant concern, our platform provides the tools, the information, and support needed by the teenagers to avoid unplanned pregnancies and therefore fostering a future of educated well-being and improved choices. Thank you.
Additionally, we understand that majority of teenagers cannot afford fancy phones which have enough storage to install a new app. That's why we've integrated our chatbot in the existing social media platforms, including WhatsApp, where teenagers can prompt messages and get all relevant information, credible information about sexual education, and where they can access contraceptives from. Our value proposition, we are offering 3 things. One is an online safe community where teenagers can talk about sex without feeling attacked. Additionally, we provide an interactive chatbot both on our mobile application and WhatsApp where teenagers can engage in a safe conversation. More to that, we are providing expertise and anonymity in purchasing contraceptives and all items related to sexual and reproductive health. We understand that we are not the only company on the market solving such a problem. Our competitors include physical healthcare facilities, as well as Rocket Health, which is a digital telehealth platform. However, we outweigh our competitors by using innovative technologies, including artificial intelligence, as well as specializing in sexual and reproductive health. As a specialty, that gives us an edge over our competitors because we bring all professionals in one place. So the market opportunity presented here is very enormous. In 2023 alone, the market potential for contraceptives and pregnancy app was valued at $1.07 US, and Bulamo Bridge aims to target 10% of this market, concentrating in areas where internet connectivity and smartphone penetration is high. So we raise our revenue. Most of our features on the app can be accessed via a freemium model where you prompt access information without any charge. However, if you want to have a one-on-one consultation with our experts, counselors, you have to pay a subscription fee, which is charged annually. Additionally, we use the Bridge online store where items including contraceptives, emergency pills, Sana Press, among others, are sold online, guaranteeing success, privacy, and online delivery. Additionally, we have in-app advertising, data sales research agencies, collaborations with healthcare facilities, and grants like one we are getting from UNFPA today. So how does this work? You download our app, and then you create a profile. According to the demographics that you feed in, we tailor information basing on your age. When you do that, we give you curated education content. There is a community of teenagers within the app that share information that you relate with. So by end of 2024, we expect to have over 200 monthly virtual conversations, either via WhatsApp or the chatbot. Additionally, through these conversations, we aim to empower teenagers with information which we aim will reduce teenage pregnancies by 27%, additionally increase contraceptive usage among teenagers. To date, we've raised over 25 in sales during consultations and online purchases, as well as empowering over 2,000 pregnant women whom we have reached through our digital tools, and expanding our reach to over 20 professional medical workers, including counselors, who are in over 6 hospitals that we partner with.
We are requesting for $10,000 in grant funding, with 20% to be used for the acquisition of a USSD code that will deliver SRHR information and support to those teenagers that are unable to download the app or use the WhatsApp chatbot. 20% will be used to address the technical glitches that have been identified on the Bridge AI app. 35% will be used on sales and marketing to increase the awareness of our product. We work with a team of medical doctors, Jovia heading finance, Patrick here works in the field of SRHR and works with peer educators, with mobile app developers in the background that are guaranteed to drive the success of our product. Please join me on this journey as we ensure that SRHR tools, information, and support are available to every teenager everywhere. Thank you.
Thank you very much, Bulamo AI. You can actually take your seats. So, for purposes of transparency, I need to let you know that the judges already tallied and came up with their results. So, if you see the teams that we have picked out to come here, don't start assuming that we've given them another chance to pitch and that the judges will look at the things and say, I think I made a mistake. No, we're doing this so that our guests of honor can actually get a feel of what your day has actually been like. So I'd like to invite West Nile Community Action for Rural Development also to take 5 minutes and walk through their pitch, and then we will take the speeches.
Good afternoon, ladies and gentlemen. My name is John Daniel Androga. I come from Yumbe district, a district that hosts refugees. I work with West Nile Community Action for Rural Development in what is called West Nile Card. Who is West Nile Card? We are a youth-led organization. We are non-profit. We are registered with the URSB. Our sectors, protection is one of our key sectors where we handle sexual reproductive health rights. We handle GBV. We do child protection. In community health, we have malaria prevention and HIV, and then we also handle WASH. Under environment and energy, we do tree growing and conservation, and then alternative and efficient energy use. Why Yumbe? Regionally, when you look at the statistics, 8,678 in West Nile. These are the cases at the West Nile, young girls getting pregnant. Yumbe alone is 3,973 girls being impregnated. That is according to UNFPA 2021 report. Looking at the Yumbe district, 1 in 4 teenage girls get pregnant. These teenage girls, these are between age of 13 and 19 years old. In our research, we looked at there's poor menstrual hygiene management. That's why these ladies get pregnant easily, because they don't have reusable sanitary pads, and limited access and utilization of sexuality education and information. Also, they lack information. Looking at our health center setting in Uganda, which is 5 kilometers apart in radius, and in rural, the young girls, they don't access this information. What is the result? The young girl is dropping out of school, as you can see there. What is our solution? We want to impact skills to these young girls on reusable pads making. Why we are including men? Because we are the perpetrators. We cannot stop saying that we want to end early or unintended without involving the boys. So here we have involved the boys to make these pads for the young girls to stay in school. In our selection, we have also 705 teenage pregnant mothers. We mapped them in Yumbe district. Access to information, as you can see, the school model, over 1,000 boys were reached with sexual education. That is in Yumbe district. You can see the pictures there as passing information about sexuality education. We want to reach to the community with awareness. We want to form youth clubs, the already youth clubs, and we want to work with them to make sure that the information is reached to other people. We want to link the youths. We want to support these youths with these ISC materials of sexual reproductive health, and we have community agents and that we are going to work with in disseminating this information about sexual reproductive health. That the community agents, we are looking at the VHTs, para social workers in the communities, that we are going to work with them. How we are going to work? We shall form and support 2 adolescent-friendly space. Under that, we shall have sexual reproductive health-related activities. We shall have male and female condom demonstration and distribution, because we have seen that young girls, young boys and young girls also, they don't know how to use condom. We want to demonstrate to them. Under that, we shall have a referral to other services. Conduct training for 100 teenage girls on reusable pads through provision of these materials. In my community, these materials are very expensive and these young girls cannot afford. So we shall train them, we shall provide them the startup kits to start producing these materials. Under that, we shall have distribution, and as a sales, we shall act as a sales agent to market their products. So like adolescent special days, we have seen that the radius of our health centers in our communities is far apart, and these young girls cannot access these sexual reproductive health services to these hard-to-reach areas. So we want to have community outreach programs on sexual reproductive health, where we are going to work with the health workers to hard-to-reach areas, conduct awareness raising, and then we want to also train 20 school champions. Our impact, we have seen the result, 8,600 in Yumbe. Our market, we want to get 10 schools. 10 schools will be identified to reach 2,000 teenage girls on sexuality. Our vision is to empower 500 teenage girls on menstrual hygiene management, reusable pads, to end early and unintended pregnancy in the Western region by 2025. So these are pictures that we have supported the teenage pregnant girls in our district with the mama kits and dignity kits.
You have 30 seconds.
Thank you. 503 pregnant girls mapped and supported. 105 teenage mothers trained on skills. We have 50 teenage girls trained on reusable pads already. We have 900 male youths reached. Our sustainability, we want to integrate our services, sexual reproductive services, into our programming, continuous entrepreneurial skills, for self-sustainability, continuous outreach sessions on sexual reproductive health, and production of affordable and accessible reusable pads. As you can see, those are some of the skills that we have given to the young teenage girls. What we are asking, we want to train and support teenage girls. We want to produce 1,000 pieces of reusable pads.
Time up.
So these are our partners. Thank you so much.
All right. Thank you so much, West Nile Community Action for Rural Development. Well done. So our guests of honor, these and more are some of the innovations that we had the opportunity to listen to this morning, and our judges have actually come up with the three topmost. But before we get to listen to our judges, would like to take a moment and hear from our guests of honor. And I'd like to invite the UNFPA Deputy Country Representative, Mr. Daniel Alemo, to give his remarks.
So good afternoon, everybody. It's really great and exciting to see so many talent in one room. And it's a pleasure, of course, to be here with all of you today. I regret I couldn't come in the morning to hear more about your innovations. But judging, I think, from the two I heard, I can see really there's no shortage of ideas and solutions. So well done and congratulations for making it thus far. 121 million. Remember this figure. This is the number of unintended pregnancies per year that UNFPA disclosed or shared in our State of World Population Report last year. So that's 50% of total pregnancies globally. That's almost four pregnancies per second that are unintended, right? I mean, in Uganda, we're talking about 1 out of 4 adolescent girls that is getting pregnant. In some areas in the country, it could run up to 40,000 pregnancies per month among this age group. I mean, if there's something that could give us sleepless nights, this is it. This is a catastrophe. It's literally a catastrophe. So I just wanted to highlight that before getting to the formal remarks, and just really commend all of you for being here. And of course, the reason that we're all here, it's because we believe that the solution lies within. And really thanks to our partners at the Swedish Embassy, we are able to live up to this principle of nothing about us without us. So really, I really thank you all for the interest and the commitment. So let me start by recognizing the Commissioner, Dr. Angela Nacafero, Commissioner for Gender and Women Affairs at the Ministry of Gender, Labor and Social Development, the Head of Cooperation at the Swedish Embassy, Adam Kasai-Rudbeck, and other, of course, members of the embassy staff, representative from the National Youth Council, our partners from Outbox Uganda here present, the esteemed, of course, judges, our young innovators who are here present with all of us, members of the media, colleagues online, Sydney, hello, ladies and gentlemen, all protocols observed. On behalf of the United Nations Population Fund, I'm pleased to witness the End Teenage Pregnancy HackLab pitch event. As we witness, of course, the 10 selected innovators showcase their solutions towards ending early and unintended pregnancies here in Uganda. UNFPA, as part of the UN Joint Program on Gender-Based Violence in Uganda, supported by the Swedish Embassy, launched this hack lab in partnership with Outbox Uganda on 7th of July 2023 to accelerate collective efforts towards ending early and unintended pregnancy here in Uganda. As you all know, according to the 2016 Demographic and Health Survey, nearly 3 out of 5 women aged 20 to 49 started childbearing while still teenagers. Teenage mothers are more likely than non-teenage mothers to attain only primary level education and 6 times less likely to complete secondary education. Keeping girls in school reduces, of course, or contributes to the reduction of teenage pregnancy, which is responsible for almost 1/5, 18% of annual births in Uganda. Nearly half, or around 46% of these births by teenagers are unwanted. If no action is taken to reduce teenage pregnancy in Uganda, we are really looking at a future where 50% of our teenage girls are at risk each given year. Furthermore, our collective concern must extend to the alarming rise of HIV and other STIs among adolescent girls and young women. We must therefore act together to reverse this trend, which has a long-term effect on the girl child and, of course, the country's development and growth at large. The inception of the End Teenage Pregnancy HackLab was driven by a vision to create a world where communities, including girls and young women, are supported and are in a leadership position to lead the campaign against early and unintended pregnancy. The HackLab is engaging youth innovators to scale innovative solutions, as we said, across 16 districts. And I will list them: Abim, Amoria, Kabong, Kabaramaido, Chiriadongo, Kotido, Napak, Nakapirpit, Pader, Yumbe, Moroto, Gulu, Bundibogyo, Kamuli, Mayugi, and Kampala. The HackLab received a total of 127 innovations from across the nation. Among these, I understand 25 eligible innovations were chosen to undergo a 2-day boot camp, and that not only trained the young innovators based on business prospects, but also enabled them to refine their ideas, priming them for further shortlisting. As you all know, of course, now 10 youth-led innovative solutions out of the 25 were selected. And today we're here to witness, of course, the selection and awarding of the top 3 solutions. I hear there may be more, but let's not spoil anything, whose capacity will be built to become change makers and leaders of sexual and reproductive health and rights here in Uganda. Now, each selected team will be connected to a community-based organization that will provide support throughout this initiative. Through a well-scrutinized through well-scrutinized criteria, considering innovative effectiveness, feasibility, scalability, and impact on target populations. We believe that the three solutions will benefit from a seed fund worth $10,000 each, alongside an additional $10,000 worth of technical assistance, including business support services on brand positioning, go-to-market strategy, and investment readiness. Our global strategic plan as UNFPA has identified innovation as a key accelerator to meet our current and future challenges and boost the impact of our work, especially in addressing the needs of populations that are left furthest behind. Therefore, it is with such ideas and initiatives like the HackLabs that we can reimagine the delivery or the more effective delivery of our programs through, of course, again, the investment in young people. Ladies and gentlemen, I take this opportunity really to commend partners such as the Swedish Embassy here in Uganda, who are investing in new solutions to pave the way towards the realization of the Sustainable Development Goals, and of course a world with zero unmet need for family planning, zero preventable maternal deaths, and zero gender-based violence and harmful practices. Through, of course, the leadership of the Ministry of Gender, Labor and Social Development, I would like also to commend the government for its support for young people through various programs and initiatives, including but not limited to the parish development model, the livelihoods program, and of course, other various youth coordination structures. Young people are the very resource on which we must rely to be able to come up with innovative solutions, as has been said, that could help really the country advance on its ambitious development agenda and reap a demographic dividend. As part of the broader and collective UN response and effort here in Uganda, and not least through the recently launched joint program on adolescents and youth, UNFPA commits to continue supporting young people in their ambitions and aspirations, and to ensure that they have a rightful space in the development of their own country. As I conclude, I would like to call on all development actors and partners here in Uganda to join us in building the capacities of young people, equipping them with the right set of skills to innovate around the realization of the SDGs. The youth stand as key stakeholders in advancing change in the country and the world as a whole to meet its development goals through delivering a triple dividend of improved health and well-being, enhancing it through the life course, through their life course, and contributing to the health of future generations. Let us therefore join hands with a shared determination to shape a bright future for young people and the country as a whole. Thank you very much.
Thank you so much, Mr. Daniel Alemu, for those wonderful words spoken and for appreciating all the partners, UN, the Embassy of Sweden, that continues to support UNFPA in delivering a world with zero unwanted children, zero gender-based violence, and all the things that you are setting out to do. Now I'd like to invite the head of cooperation from the Embassy of Sweden, Mr. Adam Kasai Rudbeck, to also come and give his remarks. Let's give him a round of applause as he comes.
Good afternoon, everyone. My name is Adam Kasai Rudbeck. I'm the head of development cooperation at the Embassy of Sweden. And perhaps let me start by thanking the Bulamo Bridge AI and West Nile Community Action for rural development for the sample pitches, which were most impressive. I think I can say that now that I know that the judges have already made their decisions. So thanks a lot for introducing us to your innovations. Commissioner Nakafero, Deputy Representative of UNFPA, young innovators, invited guests, judges, ladies and gentlemen, all protocols observed. I'm truly honored to take part of this inspiring event today, as we're here to address a pressing issue with far-reaching implications for our society, which is teenage pregnancies and gender-based violence in Uganda. And considering these immense challenges, we're glad to contribute to shedding light on the innovative approach of the End Teenage Pregnancy HackLab that we are here for today, and on how innovation plays a pivotal role in combating these issues. Teenage pregnancy and gender-based violence continue to pose significant threats to the well-being and development of the Ugandan youth, and particularly young girls, and thereby the whole of the Ugandan society. The lack of comprehensive sexuality education, limited access to reproductive health services, and deeply entrenched cultural norms all contribute to the high rates of teenage pregnancies and GBV incidents. And as we all know, these issues result in dire consequences, including health risks, interrupted education, and perpetuation of cycles of poverty. Sweden has been actively involved in development cooperation efforts to support Uganda's initiatives in tackling teenage pregnancy. Through several partnerships, Swedish development cooperation focuses on improving access to sexual and reproductive health services, access to justice, increasing access to contraceptives, and promoting gender equality. These efforts all aim to empower young people, and particularly girls, with the knowledge and resources to make informed decisions about their reproductive health. And Sweden has since long partnered with UN partners and other international agencies, as well as Ugandan civil society, to strengthen Uganda's healthcare infrastructure and promote awareness campaigns that challenge harmful social norms. Through UNFPA and UN Women and the joint program on GBV, led by the Ministry of Gender, Labour and Social Development, we have made a joint effort to effectively change the negative trend of teenage pregnancies in Uganda. And the concept of the End Teenage Pregnancy HackLab has truly emerged as a very, very important contribution to our collective efforts. It's exploring innovations that will accelerate efforts towards achieving transformative results and ensure protection and fulfillment of girls' rights. It targets young innovators who have aspiring solutions that, when taken to scale, can make impactful change for girls at risk of early pregnancy. Moreover, it's important to remember that innovation goes beyond the actual technology. It involves challenging traditional norms and fostering a culture of open dialogue. Through education, awareness campaigns, and community engagement, we can address the root causes of teenage pregnancies and GBV. And by involving all segments of society, including parents, teachers, and community leaders, we can reshape attitudes and behaviors that contribute to these challenges. In conclusion, the End Teenage Pregnancy HackLab is one step in the right direction and shows that innovation is key in our battle against teenage pregnancies and GBV. And by fostering creativity, collaboration, and inclusivity, we have the power to transform lives and create a future where our youth can thrive without the burden of early parenthood or violence. So let us all join hands in supporting such initiatives and embracing innovative solutions to build a safer and brighter Uganda for all. Thank you very much for listening.
Wonderful. Thank you so much, Mr. Adam Kasai Rudbeck, for those thoughtful words. Indeed, without your support, many things would go unattended too. We know that the support of the government is very important in being able to deliver this mandate. And so I would like to recognize and invite Dr. Angela Nakafero, who is the Commissioner for Gender and Women Affairs from the Ministry of Gender, Labor and Social Development.
The representative of the Embassy of Sweden, the head of corporation, the representative of UNFPA, the representatives of government agencies, departments, and ministries, the panel, members of the panel, the participating organizations that have really put in time to come this far, the young people in our midst, ladies and gentlemen, allow me to stand on the existing protocol. But also note that as a person, I'm honored and privileged to join you today. This is my second time of participating in a similar initiative. The first one was coming up with innovations for elimination of violence against children in schools. It was supported by Enable, and we came up with innovative ideas. So I'm glad that with the support of UNFPA and the Embassy of Sweden, we are also looking at an issue that is closer to our heart, ending child marriage and teenage pregnancy. I believe the process since